I think everything that we're seeing is just confirming what we all have been anticipating for the last couple of years, that healthcare, specifically in M2M, is an emerging space right now, and we're all excited to see things start to happen. It seems like we're facing the perfect storm where everything is kind of working together to create something big and explosive in this space.
You look at 4G, LTE, the providers, the infrastructure providers are trying to get in par to provide more connectivity, but in the same sense, you've got an antiquated systems in healthcare. When you look at the bunker style mentality of the healthcare institutions out there, with over 6,500 hospitals out there running on 1970 buildings, they're still struggling with coverage on just blind spots in their building. So the platform is sort of a tug of war for them. They want to adopt these technologies. They, with tablets being introduced to them, the smartphone devices, and having some presence model allow it. A lot of the providers here are looking to try to connect these dots together for it. There's a wealth of opportunity on both sides, and everyone's just trying to figure out how do I put these two elements together and drive profitability and a revenue cycle so they can make some money out of it.
The sheer focus and quantity of applications and devices that are hitting the marketplace is astounding. Monitors, sensors, telemedicine, tablet integration, back-end integration to EMR, EHR systems using smartphones and tablets and netbooks and PCs. The value proposition of the secure medical record being delivered to the doctor or the caregiver, patient bedside, which complies completely with HIPAA, is absolutely fantastic.
I think the overall goal of all the carriers, but specific to Sprint, is making life easier on the patient, allowing a patient to be able to recover at home, getting them out of the hospital much faster, and then helping to greatly reduce 30-day readmits. That's a big problem right now. So that's something that the carrier can do. Also, we've always been very innovative. We're known for our innovation, and so my role is to be out there identifying partners for Sprint to be able to team up with to bring new innovative products to the market specific to the healthcare. And then also looking at what we can do with fitness, because we all know that if we take better care of our bodies, then we're going to have fewer health issues down the road that are going to have to be dealt with in the hospital or outside of the hospital.
Well, you've got two really different areas to look at, right? So you've got this whole home health program, which if today they can solve some of the privacy issues, and there's independent agencies that can sort of source and handle the data requirements. So if I step on a scale and it records that information, and I have other type of sensors that I can have attached to myself to monitor those daily activities and know what the thresholds are great. Now take that information and say, okay, once I feel comfortable with that, then how do I incorporate that into now my caregiver, into other sources, knowing there's a trusting piece of that relationship. Because, again, I look at it, say if you're a 40-year-old male today, getting on a scale, going for it, knowing you're going for an additional insurance policy. Well, then somebody comes in and says, oh, you're wired for all this stuff. Well, can I get that data, that empirical data? You're going to be sort of lost. It says, well, no, that's private. That's not yours. You're going to still have to go through it. So those are the boundary lines. So what you see is a lot of the initiatives, from what Sprint's doing in enabling needs to patches to individuals trying to get better tracking and find better health and fitness about themselves. It's going to grow from both the healthcare side and from the individual side. Just think of the gaming marketplace and some of the things coming. How you integrate gaming and concepts that might be in the social network into fitness. We haven't seen those. Right? We're still thinking traditional, I go to a doctor, I'm sick, I take 2 pills, and I'm hopefully going to get better. But there is a lot more that goes to that process, and doctors are trying to figure it out a little bit. And that's where I look at this convergence model is going to happen, and there's going to be very entrepreneurial spirit, because once they figure out that Sprint, and AT&T, and Verizon have built these networks with the capacity of a broadband capacity inside of it, and the devices can take effective use out of it, and you've got good battery life. Now you're going to have a tethering model that says, how do I have a presence-based model? So it says, I'm here and here's the vitals I would like to share, and I'm willing to share this with my immediate family so they know that I'm okay if I'm traveling. And I can turn that off if I want to and turn it back on when I want to. Same thing as I say, here's your device, mom or dad, and somebody's going to come up with that model. And for a subscription-based model, you're immediately stepping into a new arena that says, once you start taking all of these endpoints data, and trend that out and figure out how do you throw out anomalies and everything else, and how do I use utilization and trend analysis, it's going to be, the game's on.
On top of that, with the new Obama administration healthcare provisions, right? And the need for practices to implement EMR and EHR systems, right? Everybody's looking at it. Everybody's looking at tablets. Everybody's looking at smartphones to be the endpoints of the systems, right? So since it's directly tied to the remuneration that the practice receives, right? You're seeing people like McKesson and Allscripts and Epic and Cerner going in and doing the deep integration for Android, for iOS, Windows Phone. United Health, I had a conversation, I was out in Minnesota with United Health a few months back, and they're actually writing Windows Phone applications for healthcare, for monitoring, right? And obviously they're a huge insurer. So with regard to that, yeah, everybody's invested. So mHealth has the single best chance from a value proposition standpoint to have mobility and wireless improve people's lives, which is why so many people are focused on it and why so many people are excited about it.